Hi, this is Dr. Sarvar Pathan. I am the owner of Personalized Physical Therapy and Wellness here in Winston-Salem. And thank you very much for the opportunity to be able to fulfill this vision that we have for the community, to be able to serve at an underserved level for the community. We have a practice here in town, and we started to realize more and more after I was practicing. I and my wife, we were practicing in the physical therapy, setting on the traditional side, that we weren't able to provide the level of quality that we would like to for the patients. Obviously, the prevention and the wellness aspect of physical therapy is not something that is being explored on the physical therapy front a whole lot, and hence that's where we started our practice. Our vision is to be able to help improve the pain-free activity levels of the people of our North Carolina using the hidden powers of physical therapy and wellness. And that's the hidden power that prevention and wellness holds. And it's not really something that we do as the forefront of physical therapy just because either insurance reimbursements are a big deal, or that people aren't aware of keeping it, a preventative measure. Hence, the physical therapists are not set up to use that potential, and that they can express and help the communities better. Hence, that's where our existence in the physical therapy world and the service world comes in. And we started our practice in 2018. It's called Personalized Physical Therapy and Wellness, here located right here in Winston-Salem. We've been able to serve the whole triad and also the mountain community in Boone and Blowing Rock, and the Watauga County in that area. However, there, a year in, we started to feel a regret that we currently using the model is that we have a mobile physical therapy model that we provide, and we serve the community where the need is, be it in their own home, be it in their office, and obviously with now that we are working with the patients directly, we keep our quality very, very high. We work directly with our patients. If they like our services, they continue with us. If they don't like the services, they discontinue. Hence, at the same time, providing the wish that we have is to be able to leverage what we can offer as an independent physical therapy practice. So combining all of those together, one of the regrets that we have currently is, because it's a service that can only be afforded at an out-of-pocket cost. We're not able to serve the people who cannot afford our services. One of the good things about people that have to pay out of pocket is that their motivation level to get better is really, really high. But at the same time, when you look at affordability, it can only be afforded by certain people that have the opportunity to be able to provide for their services. So for the underserved population, we would like to be able to, this was the vision, this is the current vision, is to be able to serve at the same level of quality, the convenience, the mobile aspect, and serve the people that are not able to afford that services. We started to talk to our patients about this vision that we have, and we also started to communicate to some of the well, primarily the patients, I should say, and one of the patients recommended we should go talk to the nonprofit Winston-Salem Foundation. So we extended our message to Winston-Salem Foundation, and they recommended that at this current time, with maintaining the business as well as looking at a nonprofit, because that's what my vision would be, is to be able to create a nonprofit, and this nonprofit will be able to serve the community. It was recommended that we would align our vision to a nonprofit who has a very similar vision, and we'll be able to provide that services by aligning that vision. There are a few benefits with that. Knowing that the nonprofit is already established, there may be opportunity where there are already grant money available to be able to serve the population. That's one. Second is that through Winston-Salem Foundation, they can only, let's say our patients, some of the patients that has expressed interest in funding for that opportunity, that these patients, which is a current, currently a minimal fund, that they would support, and they would fund the nonprofit, and then that nonprofit would be able to handle the money and distribute it to how it needs to be distributed. And then the third is that over the period of time, as we grow this project, that we would be able to leverage and ask for more grant for different um, needs, that as the project grows, and be able to serve more underserved population. So that's the idea. That's the current vision that we have, for helping us being able to fulfill that vision. And we would love to be able to do that by partnering with, in the initial recommendation that we have from Winston Foundation, is potentially partnering up with one nonprofit in the area that has similar vision. And we looked in the list of nonprofits that Winston Foundation recommended us, and SG Atkins Foundation, provides us the closest opportunity to what we would like to partner up with. Now that we have discussed on the meeting that Winston State University also has a foundation, and as Judy had mentioned about the opportunity for the students to be involved and being able to use some of their talents, and obviously it's a pretty good learning experience for them. Um, and being able to use the funding amount to potentially provide for a position that a physical therapist can have as a supervising clinician, and then they can serve at a level where they are supervising the students, and then obviously at a layer below, where that the patients are being addressed and being seen, and the quality be at the level that that personalized physical therapy currently supports. And obviously, as a business also, we would love to be able to support this project, through different ways that we can think about. But that's the current idea, that's the current vision, and would love to be able to support that, and extend that out. So thank you very much for the opportunity. Look forward to meeting you guys again in a month. And thank you very much.